Hi guys, Dr. Gamble here, chiropractor at White Oak Family Wellness in St. Charles, Illinois. What I wanted to show you today was a little bit of what a chiropractic treatment for patellofemoral pain syndrome might look like. You may know it as a runner's knee. With her, I've already done an assessment, kind of figured out where her issues are coming from, and so we're going to work with that. It might be different for you, obviously everyone's different, and even patellofemoral pain syndrome has a lot of different reasons why it comes about. So what you'll see here is kind of just an idea of what it might look like, more so than exactly what it would look like for you. Also, I'm going to focus pretty much on the chiropractic adjusting side of things, because we've already done a little bit of a video talking about some of the stretches and exercises you might do. And if you want to look at that, go ahead and check us out on the channel there. But for now, like I said, I've already done the assessment, figured out what we need to work with her, and so we'll just go ahead and get started and show you that. So the first thing I'm going to show you here is we're going to work a little bit with the fibula and how it articulates with the tibia. So what I'm talking about here are the two lower leg bones. Primarily, the tibia right here on the outside, and then the fibula. What typically happens when you get muscles that get really tight on the outside here, like the IT band, is it will pull a little bit on that fibula and actually externally rotate it. So what we want to do is bring that back into internal rotation. At the same time, the tibia tends to be a little bit more internally rotated, and we want to bring it back into external rotation. That has to do a little bit more with what comes with like flat feet, but that's kind of a story for another time. So for her, I already know that she's restricted a little bit in that internal rotation of the fibula / external rotation of the tibia. So we're going to go ahead and work with that. Again, this may not be exactly what it looks like for you, but it'll just give you a good idea. So what I've got here is a toggle board. We use that to go ahead and use it's like a controlled thrust, so that way it's a little bit more gentler. I'm going to contact the fibula here using my hand. And once I get that tension, I'm just going to externally rotate it here, the tibia, while I internally rotate the fibula and press through. And one more time. All right. Get this all out of the way. Another thing that commonly comes up a lot is a decreased ankle dorsiflexion. That's when the toes are coming up towards the shin. It can actually change your biomechanics a bit. And with her, you can kind of tell, maybe from the camera over there, that she's got more on this side than she does on this side. So what we're going to go ahead and do is loosen that up a bit. Have her hold on to the table. And then we're actually going to adjust that. And that's that. The next part that we usually deal with is the hip internal rotation. That's because as you are running or walking, let's say with your right leg as your lead foot in the moment, and your left leg is lagging, as your hips kind of come forward on the right with that lead leg, the left side lags back, obviously, and the hip has to internally rotate in order to kind of stay in line. If you lack that ability, or if it's not as good on one side compared to the other side, it will actually change, obviously, the position of the whole thigh bone as you come through, and will actually affect how the patella will run through that groove. That's not an issue for her, so I'm not going to adjust it today, but it is something we do see kind of a lot when we deal with this. I hope that's helpful, and if you have any questions, please feel free to drop them in the comment box.